Kia ora team, my name's Ben and today we're going to look at our primary survey. So this is the first assessment of our client, and the way to remember this is Dr. ABCDE. So let's get started. First thing is danger. Before we even arrive at the scene, we're going to look at our fashion. So we're going to have gloves, boots, glasses and a mask. That's pretty standard. And then our accessories. So what are we going to wear with our fashion? We're going to have our first aid kit. We're going to have an AED, suction, oxygen, and then depending on the situation, if we're around traffic, we're going to need our high vis, and if we're going to be getting in and out of dangerous spaces like a car that's been in an accident, we may need a helmet. Then we're going to look at the patient and the people and the environment. So PPE. Is the patient aggressive, intoxicated? Are there any weapons around the scene? And then people. People we want. Are police necessary? Are the fire department necessary? If it's a road traffic accident, we want police to cordon off the area and make it safe. The fire department may be needed to extricate people from a crash. And then hospital. Where is the closest hospital if we need to go? And where is the closest backup if we have to call for them? Then the environment, looking around, what's the weather like? The time of day, any hazards around the client, glass, traffic, power tools, any other hazards like dogs or wild goats that may cause a problem. Then coming into the situation, what's the access and egress going to be like? Can we get our stretcher all the way in, right close to our client? Or are we going to have a problem? Are there lots of stairs? And then finally, around the client, is there enough space? Can we perform high-performance CPR, or do we have enough space for assessment? Moving on. Now, the first R, redness. Is there any uncontrolled life-threatening bleeding? When you're looking at the client, is there a bleed that's so intense that this person's not going to live for the next 60 seconds? If so, this is what we have to address first. If there is a small bleed that seems controlled, then we can probably move on and address it once we've completed our primary survey. So our second R is response. So a quick response of an ABPU assessment. The A stands for, are the patient's eyes open and they are alert? As you approach the scene, is the client looking around for you? If not, then we go and introduce ourselves. Kia ora, my name's Ben from the ambulance. So if that causes them to open their eyes, then they're a V on the ABPU scale. If no response, we'll do a subtle trap squeeze looking for a pain response. If they open their eyes, they're a P. If no response, they're a U. DRABCDE. So the next one, airway. So we want to assess for the patency and maintenance of the airway. So we're looking for these things. Choking, cyanosis, so blue around the lips, any drooling, so drooling could indicate an airway obstruction, snoring, or stridor. If there's a problem, we need to address it straight away. So are you going to do some form of maneuver to remove an obstruction, or we're going to have to do a head tilt chin lift, use the sniffing position or a jaw thrust, or the recovery position to resolve these issues. And potentially we may need an OPA, MPA, or suction to sort out the airway before we move on. Dr. AB. So now we get to breathing. We're looking for a symmetrical chest rise and fall for a normal rate and depth. Any signs of respiratory distress? So are they using a lot of accessory muscles? Are they bent over in a tripod position to help them breathe? Can they talk in full sentences? How many words of breath does it appear normal? Or are they breathless? So for any problems, we need to address it straight away. Do we change their positioning, get them to sit up? Do they need oxygen to be administered? Then we're coming across to C. So circulation. Before we touch anyone, if they're conscious, we want to make sure we don't surprise them and we want their consent. I want to take your pulse to check your circulation. Do you mind if I touch your wrist? So when we're palpating the radial pulse, we want to check the strength, the rate, and the regularity. And while you're palpating that pulse, you're also going to get an indication of their skin color, and is that normal for them, the temperature of their skin, capillary refill time, and noting, is their skin dry or sweaty? Then the next step in circulation, we're looking to check for any bleeding. Again, we want to inform consent. So I want to check for any bleeding we can't see by palpating you head to toe so we don't miss anything. Is that okay? So therefore we're going to, with our gloves, we're going to wrap around, make sure we palpate all the areas, and then check our gloves to check any blood. And then the next section, check, and then each individual portion and checking your glove. Right, Dr. ABC D. Now we're back at disability, so reassessing their AVPU score. Are they still alert, looking around, watching what you're doing? If so, they're an A. If not, ask them a question. So what happened today? Does that prompt them to open their eyes? So they'd be V. If not, trap squeeze for a pain. Then they'd be a P if they open their eyes. If not, they're unresponsive. And then finally on our primary survey, we've got E. So E is the environment. And we're looking at the patient's immediate environment. So we're going to make the decision, do we stay where we are or are we going to have to move them? Looking at the weather, the hazards, again, are there any wild goats, and privacy. So do we move our client to keep them warm or can we continue the assessment here? Remember, trauma patients should be kept warm and medical patients should be kept cool. So at this stage, we're deciding, do we move them into the ambulance or can we cover them with a sheet before we carry on? All right, and that was our primary survey. In real life, without so much talking, this should take less than 60 seconds, and we're looking for things that are going to cause the patient to die within the next 5 minutes. And once we've gone through this, if this is all clear, then we can proceed on to our secondary survey and delve more deeply into each of these body systems. All right, team, give it a go and happy studying.